It's 1 minute after 11 here. Nigeria's phone health radio station, Wash 94.9 FM. My name is Anthony Del. Now that's the 10th day in the month of April 2025. I made you understand that today we're going to be having a special interview session kicking off from 11 o'clock this morning. We're your health-centric radio station, unapologetically health-centric radio station. So everything that concerns and pertains to your health is certainly what we're all about. And this morning, we're going to be talking about something. Yes, I played for you the anthem of Ilera Eko. They say, Ajoshe Bubuwani. It's what we all have to get to do together. And we know that Lagos State government, has, it's called it out in Yoruba language, Ilera Eko, meaning a healthy Lagos, especially for those that might not necessarily understand. And it emphasizes more or less the grassroots quality of the state health insurance scheme that has been taking, a mandatory course. And of course, this morning with us live in the studio of Nigeria's phone health radio station, Wash 94.9 FM, we've got the permanent secretary talking about LASHMA, Lagos State Health Management Agency, in person of Dr. Emmanuella Zamba, here with us to discuss, more about Ilera Eko, ensuring that you get enlightened, ensuring that, your questions about this particular program is absolutely understood here in the stables of Nigeria's phone health radio. Good morning to you, Dr. Emmanuella.
Good morning. Thank you for having me.
It's a delight having you here in our studios of Nigeria's phone health radio. And of course, we do not take it for granted. And I know that Lagos, of course, we're ready to get into the conversation properly. And talking about Ilera Eko, it's for those that perhaps might not necessarily have a prior knowledge or not necessarily understanding how this program works. Perhaps you can, enlighten us a bit with regards to the program, Ilera Eko in itself.
Okay. Well, Ilera Eko is the nickname that we use for the Lagos State Social Health Insurance Program. Essentially, that program is set up to be able to ensure that all residents in Lagos State have access to quality and affordable services. Whether you are a rich man, beggar man, poor man, whatever it is, the social health insurance is for every single person. As long as you live in Lagos, you have access to health insurance. That being said, I use the words affordable and I use the words quality. With regards to affordability, because it is a social health insurance plan, it is really, really, I would use the word cheap. And that is to ensure that the majority of the masses are able to come on board onto the scheme. It is heavily subsidized by government. Our governor, Mr. Babajide Sanwo-Olu, is extremely passionate about social protection, and this is one of the major programs, especially within the health space. We have a basic minimum health plan for people. We have looked at the disease burden in Lagos State, and this plan is to satisfy at least 80 to 90% of what people would normally need to access healthcare for. It is something that you can access from both public and private hospitals. Currently on our network, we have about 400 health facilities participating. And we also have community pharmacists participating, almost 200 of them. And that is so that people, when you go to the hospital, there's an issue around your drugs, out of stock, etc. You can walk to the nearest pharmacy under our network and you can get your drugs free of charge. So there are lots of innovation that we've put into this thing to make it very welcoming for the masses. We have an installmental payment mechanism because we know that the majority of people in Lagos are in the informal sector, about 70% and counting, and they do earn their income on a daily basis. So even though we say it's cheap or affordable, for some people, they might not be able to pay that money at once. So you have the means of being able to pay that money on an installmental basis. We have a grassroots presence. As we said, we are targeting the informal sector, which are the large majority of people that do not have health insurance in Lagos. And we have divisional offices and subdivisional offices spread across the whole of Lagos. That being said, it does not mean that because we are grassroots oriented, we do not have corporate clients or people within the formal sector coming on board. We have a call center, which is 24 hours. We have presence on all the social media platforms, name it, Twitter, Facebook, blah, blah, all of them. We do have presence there. We have, as I said, toll-free lines for our call center. So it's at no cost to you. We pick up the bill. You can call us once you get to the hospital, and they'll sort out your issues. We have a chatbot on our website. We have a very active website. You can talk to us on the website. We have WhatsApp numbers. We're trying to make ourselves as accessible as possible to everybody across Lagos. So really, it is a scheme that, as you mentioned, has now become mandatory. Mr. Governor in July of last year brought out an executive order, and that executive order now makes social health insurance mandatory for every single resident in Lagos State. We have, of course, we know that we have private health insurance in Lagos State, and we are partners in progress. So, because I know that will probably one of the questions that I'm going to get, if I have a private health insurance, so do I need to pay for Ileraco? So there are arrangements ongoing with the private HMOs to ensure that you do comply once you have bought your plan from them. And I believe that in very short time, we'll be able to bring out all those information for people on the private health plan. So just relax. It's compulsory, yes. If you have a private health plan, speak to your HMO and ensure that you are in compliance. For everybody else that is not on private health insurance, we expect you to key into Ileraco, unless you are also on the federal health insurance plan, which is run by the National Health Insurance Agency for federal workers, etc. So we are working to see how we can roll out enforcement in the third quarter of this year, but we have a moral obligation to ensure that we propagate public awareness and ensure that everybody is aware of, you cannot punish people for what they don't know, so to speak. So we are on a very determined and intentional public awareness campaign to ensure that everybody understands what is beneficial to them on the health insurance, and that it is now compulsory, as well as making sure that people have access from wherever. We even have a USSD, which you can use to enroll yourself. For those of us that have the, what do they call those phones? Yorubas call it what is that? Balasa phone, or there's another word, so that you don't say because you're not IT compliant, you cannot come onto the scheme. You can use the USSD. You can walk into our offices and get yourself enrolled. I think I'll stop there. Do you want to talk about
Yes,
the benefit package? I can do that.
Before we get into it, I think you were just going to give a rundown, basically, of what we're supposed to talk about today. But very good. We're still going to talk about the executive order you mentioned since July, 2024, when it was enacted, where there was going to be some form of the governor signed an executive order, to enhance healthcare delivery. Then I also read sometime early this year in January, there was the news on the Bangor newspaper that stated that by third quarter of this year, they want to ensure that Lagosians have a mandate. They're mandated to have, an insurance scheme. So I was going to know how that's been going, because I also read some time in December, I think it was on record that about 1.3 million Lagosians have already enrolled in the city of over 20 million. I'm looking at the time frame within third quarter of this year, 2025. How do you intend to go about that?
Okay, so because we say we are starting enforcement in quarter three, does not mean that we expect all 20 or the million people to come on board at the same time. It just means it is a progression. Universal health coverage is a journey, right? And we expect that over time, once people know that this thing is now mandatory and there are structures in place to ensure that people conform, gradually we will have everybody coming on board. So it is not to say that the target for 25 million people is quarter three. It is to say that we will start enforcement, and we do believe that in the shortest possible time, most people and everybody would conform to what is happening.
All right, now let's look into Ileraco as a program for itself, and just like the theme Ileraco Ajoshe Gbogbo as you about says, it's our work. It's something we have to collectively get to do together in order to ensure and enhance for a good healthcare system in Lagos. I want to understand, you must definitely have had to deal with some kind of challenges one way or the other, because it's a lot what you're doing, and we know that health in particular is germane, is very key to all of our economic growth. And I want to understand, what are the challenges that might be facing the healthcare system in Lagos, and even the one that Ileraco has been able to address over time since in existence, and how perhaps you'd intend to address them in the future.
Okay, so first thing I'd say though is that health insurance is a health financing mechanism
Okay.
or initiative. And what that means is that you get money from the demand side
Yeah.
and the money follows the clients into the hospitals. It provides some level of guaranteed income for the providers. And it is also a game of numbers. So if you have sufficient clientele in a hospital, you have guaranteed income because the provider payment mechanism that we use is we use capitation and fee for service. Capitation means that every month you get an amount per person that is enrolled in your facility. That is paid to you every month in advance, right? So whether that person comes in or that person does not come in, that money is paid to you in full for each and every person that is enrolled, right? There's also the fee for service, which there are some of our services that you provide, you send us a claim, and then you get your money back, right? So these are ways to help the supply side to grow and assure some level of quality. The more clients they get, the more money they get, and so on and so forth. So it's a mechanism to help the supply side to improve in terms of quality and the gaps that are there. In terms of how the scheme has supported facilities, we actually do have what we call a provider support fund, which when you look at strategic facilities that we feel we need to have access in those facilities, we are in a position to provide some level of support to ensure that that facility is available for people to walk into. We're IT based, so what that means is that there is a level of efficiency to what we do. When you come into the hospital, they have to latch onto our platform, and all those things are done in real time, right? End to end of everything that we do is IT based. And that is also of advantage to the hospital because they don't have to go through millions of medical records, find somewhere to store records and things like that because everything is on the system. We do have quarterly meetings with our providers. We have a quality assurance, very vibrant quality assurance program, whereby before you come aboard, we come and inspect you, we give you a quality improvement plan, and we monitor you on that quality improvement plan as you go along. So we do not expect you. If we met you on level A, we expect you to continue to progress, because quality is a continuum. We also conduct clinical audits, which helps us to know that, the hospitals are following the standard treatment guidelines and doing what they're supposed to do, so that we have the kind of health outcomes that we expect. So there is a lot that is going on through health insurance for the supply side to help to improve that. And as I mentioned, it is not just public facilities, it is also private facilities. In fact, we do have more of private facilities on the scheme than public facilities. And the numbers continue to grow. We are not static. We will continue to ensure that, we bring on board as many providers as we are able to ensure that this thing is everybody, wherever you live in Lagos, you have access as close to you as possible into a facility. So yeah, a lot is being done. I can go on if you want.
Well, let's look into perhaps access to healthcare as well, because we know that there are certain persons, especially if we're going to consider grassroots level, that tend to, maybe for certain reasons, if you're going to put finances into consideration, we would say they do not necessarily have adequate access to healthcare. What about that gap? How have you been able to, so far close that gap or bring access to health closer to the grassroots?
Okay, great question.
Okay.
Social health insurance principally is about equity as well. Equity means that everybody, regardless of your socioeconomic status, you will have access to the same kind of healthcare that those that have the funds will have. Our governor, I mentioned before that our governor is a social protection champion and a universal health coverage advocate, serious one in Lagos. And he has not only shown that just by the executive orders and setting up the agency's work, he has also, with the provision by the law, where it says that 1% of the equity fund, 1% of the consolidated revenue fund must be set aside as equity fund to be able to pay for vulnerables in Lagos State to come onto the scheme. That started in 2022. And recently, last year, he was the first governor to set up the equity fund as a first line charge. Now, what that means is that the money comes out by roads, kind of like how you do salaries and things like that.
Okay.
And you're able to predict that money coming in, and you're able to bring on board vulnerables. We do have an arm of LASHMA that is dedicated to that. It's called the Eco-Social Health Alliance. And their job is to, they have field officers in all, and the field officers are residents in our communities. And their job is to identify those that are vulnerable and register them, and then we pay for them. This year, our governor has gone a step further. Last year it was 1 billion. This year, he has allocated 3 billion for coverage of. So you can see that Lagos means business, and our governor is showing that in every way possible. So we are continuously enrolling people that are vulnerable onto the program. So far, I think we've covered about 400, going to about 500,000, and that number will continue to grow. We have also put into that what we call a sustainability component. And what that does is that we help the vulnerables that we've put onto the scheme. We started it as a pilot, and we see that it's kind of working. So we'll try to scale that up. We put the enrollees into some kind of empowerment program, working with some of our social protection agencies within governments and even without. For instance, last year, we trained about 209 of them with the Ministry of Women Affairs and Poverty Alleviation, and they were given skill acquisition as well as starter packs, right? And because we know that this fund is not elastic, right? No matter how much you set aside, we know what the poverty rate is in Lagos. You'll never really be able to cover everybody at once,
That's
right?
true. That's true.
So how do you make the funds sustainable? One of that is to ensure that when you bring somebody on board, that person gets some level of empowerment, and then they are able to now pay for themselves, albeit instrumentally, and their families after a period of about a year or two. And so that person is dropped off, and you can pick up somebody else, and the train moves, right? Thus far, we have had like 2 sit-downs with the people that we started the pilot with, and it's looking really positive. We're hoping that they'll be able to start paying for themselves come next year when their current premium policy expires. And that is another way of ensuring that the train continues to move in terms of social protection for the vulnerables in Lagos State.
Fantastic, I must say. It's 18 minutes past 11 here. Nigeria's One Health Radio, Wash 94.9 FM. And not to forget, we've got Dr. Emmanuella Zamba here with us this morning. And we're looking into Ilera Code together. And I still want to ask you now, so for a fresher, someone who perhaps no idea on how to perhaps go about this, go about being a beneficiary of this particular program, how do they start? How do they begin the process of, benefiting from this particular plan, be it informal sector, private sector, whatever, and you might want to look into?
Okay, so as I said, we are not just looking at the informal sector, we also small SMEs, people that might not be able to afford private health insurance, etc., can also come on board. So you can go onto our website, lashma.com, and you can self-register, right? You can we have a chatbot on there that you can have a conversation, and they'll send you what you need to start working. You can go to our social media pages and make an inquiry, and the client services will respond to you on how to go about doing that. You can also come into our head office, which is in Alausa, which is opposite the Secretariat. We do have a service point there where they would be able to walk you through what you need to do. As I mentioned before, we have divisional offices and sub-divisional offices. In total, we have about 33 or thereabouts outlets across Lagos that you can walk into. We have staff that are full-time, and they will attend to you. You can call our toll-free numbers, 0800 Ask Lashma, 0800 Iliraiko, and there will be somebody to answer you 24 hours of the day. We have a sales hotline, 0700 Iliraiko, that you can call, and they would also give you that. We have WhatsApp numbers. We have phone numbers that you can also call, and they'll support you in coming on board. With regards to, we're also working with other ministries, departments, and agencies of government to ensure that if you go to their website, there is a link that will help you to access registration and all the information you need to come on board. That is something that's currently ongoing. We are also working with what they call Citizens Gate, and that is also being provided. We work with LASRA, so if you walk into a LASRA office, you are able to enroll and so on. So we are spreading our tentacles across Lagos. As I mentioned before, we have a USSD code, *6700 *006 hash. If you go on there, you are able to enroll yourself onto the scheme. I think I would say that in terms of accessibility, the program is making sure that you can reach us on all fronts, really and truly.
So far so good. Looking at how this this package has been for quite a while, the program that is, how would you say how has the acceptance been? How would you say it's been? Do you think Lagos are well aware? Do you think that perhaps there's still more we can do? Obviously, why we're even here having conversations as such.
Public awareness is an unending continuum.
Mhm.
You will have to continue to do that. We are on radio stations. For instance, we're here today, but we have some permanent programs on about 6 radio stations that are aired every week, where members of staff go in there, answer questions, and provide even more information to people. We do carry out community engagement, community storms, etc. We work with the parlors, the local government, etc., to ensure that these people that are living in the grassroots, we're able to access them. So public awareness is a continuous effort by the agency. We also hold quarterly media parleys where we call in quite a bevy of people in the media space to help us to spread the gospel even more. And also we're planning to open our own like an online radio station, hopefully before the end of Q2, so that 24 hours of the day you can reach us and ask questions as well, etc. So I also talked about the social media. We're very vibrant on social media. Our handle is Lag Health Scheme. Whether you go to Instagram, Twitter, Facebook, even Threads, we're on YouTube. We have a television, whatever, on YouTube. So the public awareness is continuous. However, we're all Africans. We know about our culture, whether it's religious or cultural. People feel that asking them to pay for the sickness that they don't pray for
Yeah.
is a challenge. You would hear things like, "That's not my portion. I reject it in Jesus' name," etc. So it is a challenge. It is a mindset that has been there for generations, and it will take a bit of time to get people to now naturally, accept it. So we are aware that there is this challenge. Even when you look at the National Health Insurance Program, that also has had its own challenges, and that's why the state health insurance agencies were set up to be able to localize the health insurance drive. So we know that it is for people that are largely in the corporate sector, it is now a norm because they do that through their companies and things like that. But for others that are used to this out of pocket, it is a struggle. But public awareness, community engagement, we do things to ensure that we entrench ourselves in the community and that Ilera Eco is now something that everybody is aware of within the community. And once you are close to the people, eventually you will be able to change their mindset. You'll find that most of the people that would heed your call, first off, are people that probably have someone that's ill or have had somebody close to them that passed on or had a serious, became financially impoverished because of illness. Those kind of people, because there is an experience that is personal to them, they will come on board, right? But for those that will tell you, "I'm very healthy. If I pay for this insurance and I don't use it, what do I get back?" And the response is, if you pay for your car insurance, do you get anything back, right? You do not know when you're going to need the health care. You don't know if it's going to be you or a family member. So why don't you just make this small payment, and ensure that the day it comes knocking, even if you have 0 naira in your pockets, you can majestically walk to your provider and you will be able to get the services that are covered under the scheme. So yeah, it is a continuous drive to get people to understand the benefits of health insurance and to come on board. But I do believe that it is a progression, and where we started maybe 2-3 years ago is not where we are now, definitely.
Absolutely.
And so it'll continue to get better because it is here to stay.
First of all, I think I must give you your flowers. I must commend you greatly for, because you mentioned a lot, and I just keep listening, and I see that there's a lot that's been done. There's even a lot more in the offing that is to be done, and I cannot help but appreciate your leadership.
Thank
And it's also going to bring me into your part, the role that you get to play as the permanent secretary, and how it has been for you. Obviously, with everything you've mentioned, it shows that there are plans. It shows that there's a structure, and your track record is also already speaking for you. And I want to know what the goal is. What do you think in the next give or take 2, 3, 4 years? I know already you're looking at third quarter this year, 2025. There's a target, but now let's look at Ilera Eco in the next maybe by 2030. We tend to have all these vision 2030. Let's give it vision 2030. What do you think as at that period should have been achieved?
Okay, so I'll play along.
All right.
By the year 2030, we expect that majority of Lagosians should be on the Ilera Eco scheme, whether through partnership with the private health insurance or coming to the agency directly. We also expect that if the more people that come on board, we will be able to expand the benefit package. So what social health insurance is that you do not have a finite package. Where we started in 2021, we increased the benefits. We've increased them again in 2024. So it's like it will help you to be able to cover as many services that are needed as possible over a period of time. Okay. So I expect that even more slightly highfalutin services would be able to come onto the benefit package, and people will be able to access that for a song, right? I also expect that majority of our health providers would be in the Ilera Eco network, and people are able to, it's just down the road from you. You can walk into any health provider and you will be able to get access to Ilera Eco. We are also championing telemedicine to try and reduce the load in the hospitals. That is something that is now an integral part of the standard JARA plan, which we sell as a basic minimum package. And so from the comfort of your home, you can also have access to speaking to a doctor, either through a hotline or you download the app and you can have an audiovisual conversation with your doctor, so that you have various options for accessing healthcare, right, at your convenience and for a very affordable rate. So that is the vision for Lashma, and that will be able to cover a lot more vulnerable people. And through this drive, we are able to help them to empower themselves, in partnership with others.
Okay, as much as I would love you to keep up the conversation on as to how it benefits, Lagosians, let's also look into the health sector. Because, recently we've been seeing in the news, brain drain, see, nurses leaving, see, doctors leaving, and all of that. So are there plans, as to mitigate or ameliorate that situation, so as to at least have more of our healthcare workers, remain in a very, I think, welcoming, enabling environment, just in order to forestall, more of our health workers, leaving the shores of this country. Any thoughts on that?
Okay, that is the direct purview of the Ministry of Health, headed by the Honorable Commissioner. But I will say, because he's not here, to champion the fact that he has been a serious advocate for how we can improve the HR challenges, which are not peculiar to Lagos, by the way.
Absolutely.
If you look at it comparatively, Lagos is even at an advantage to other states, because people come from other states to Lagos and then they might want to japa, So Lagos, in terms of numbers, we do have much more healthcare workers than other states in Nigeria. So that is something. We are also working on how we can produce even more healthcare workers, right? Recently, I'm sure you saw that in the news, we are converting the Cardiac and Renal Center in Magada to have an institution to be able to churn out even more health workers, be they doctors or nurses, right?
Yes.
So we're trying to expand the number of people that would be brought on board at the same time. You are aware that we have started we have a school of nursing, we have a college of health technology. How do we ensure that the numbers that we're currently churning out, we're able to churn out even more? And then how, of course, there are conversations going on as to how there can be an improvement on the remuneration. But I will say, though, that when you compare what Lagos is paying to others, I think we are comparable maybe to federal in terms of what the take-home pay is. And there are other incentives that come on board for healthcare workers in Lagos. So there is a lot going on in Lagos. We are also very big on public-private partnerships. So for some of the services that we're providing, we are looking at how we can leverage on the private sector to help us to, ensure that we have a better spread of service, and we can guarantee sustainability of these services moving forward. So I must tell you that our governor is someone that is you know that our first lady is a medical doctor.
Yes, that's
So
also.
he is very passionate about doctors and about their challenges and so on. And so a lot is going on. And as we continue, we just talked about the cardiac arrest center that is being converted.
Yes.
Other things will are in the pipeline and will be coming out to show that Lagos is really serious
That's brilliant.
about addressing the HRA challenges.
That's brilliant. I think there's no gainsaying that as compared to other states, that Lagos, of course, prides itself as one, with that prioritizes its health sector, makes it an enabling place as well.
Indeed.
But now we've looked at the role of, the Lagos state government. Let's talk about the role of the people. What we talk about the collective effort of the people in order to ensure or foster for quality healthcare. How do you think Lagosians can collectively play a role together in ensuring for such? I would just make a little pass into the situation that we saw on social media the other day, where we had this social media activist and person of Vincent Otte, who stopped. I think you must have seen that viral video where he stopped I think a street urchin from defecating, open defecation. So that and many more. So what do you think, Lagosians, the citizens, the listener listening, this morning, what's their role? What part can they take in ensuring for, quality healthcare in the state?
The first thing I would say is that we need to take our health a lot more seriously.
Okay.
There are a lot of people walking around, they're like literally like walking corpses with their blood pressure in the skies, or they have diabetes and they don't know. So, there's been quite a lot in the news where you hear somebody just dropping dead and so on and so forth, simply because, they were not aware that they had any challenges and they were not ready to go to the hospital. We need to take our health more seriously, because it's not everything that makes it obvious to you that you have an issue. Having annual wellness checks, for instance, is something that Lagos residents need to take more seriously. Just because you feel you're fine doesn't mean that you are fine. You need, to have everything checked. Once a year, there must be an annual wellness check that you do. So even if it is just for that, come onto the health insurance and ensure that every year you get a clean bill of health, and they can red flag whatever it is and you're able to adjust it so that you have longevity and quality of life. It's really important, right? People just come up with strokes and things like that. You really need to. And hypertension is a very serious problem for Africans and even in Lagos State. There was recently, we have what we call virtual booths in about 5 markets across Lagos State. And we do blood pressure checks and so on. In many of those markets, well above 50% of the people in that market are hypertensive. And many of them do not know that they are hypertensive. So that you are walking around doesn't mean that you are okay. And the least you can do that you owe yourself and your family, so you don't die of young and leave your children or your wife or whatever, is to ensure that you come on board and you're able to have the health checks that are necessary so that you can, lead a quality life. And they're not asking you for an arm and a leg. If you're able to renew your plan every year for a finite amount, which, let's face it, if you were going to pay out of pocket, it would be so much more. We see loads of people. See the gentleman on social media, whose wife unfortunately passed because he said the private hospital was asking him for an amount, and so on and so forth. On this scheme, if you pay the family plan, which is 55,000 a year for a family of 4, all right, husband, wife, and 2 children under the age of 23, or a principal and 3 children under the age of 23, or you pay 80,000, which covers a family of 6. That woman would have delivered without that man paid a dime. And we have testimonials. If you go to our pages, every week we do testimonials for those under ECOSHA, which is the vulnerable program, and that's on Mondays. And then on Thursdays, we do testimonial Thursdays for people that actually paid and came onto the scheme. A lot of people, we're saving a lot of lives, because many men, and cesarean section does not always tell you, you will not know. Many just find that suddenly the woman is going to, and then you see the husband running all over the place, asking people to borrow me money, do this and do that, which is not necessary. If you just buy the family plan, if that woman needs a cesarean section, she will get it free of charge. If she needs blood transfusion, she will get it free of charge. If that child needs to be in an incubator or has sepsis or jaundice, that child will be taken care of under this scheme free of charge. So, for the amount that you're paying, you cannot quantify the benefit that it gives to your family, really. And then you're able to now use your other income to send your children to good schools, feed them well, and so on and so forth, and not suddenly find yourself financially impoverished because you didn't plan for a rainy day.
Once again, of course, to you, the listener, you're listening to Dr. Emmanuella Zamba, and yes, she is the permanent secretary of the Lagos State Health Management Agency, LASHMA. Together, we're looking into Ilera Eco, working together for quality health, and we've been able to, look into the integrity of Ilera Eco, and of course, how it also pertains to you. But taking a little, a detour to some of the achievements that I know that you've as a platform, as a program, you've been able to achieve sometime in 2023. I think we won the best state health insurance scheme in Nigeria for, I think that was in 2023. So I want to know how that has helped, inspired you, especially as the permanent secretary of the state, obviously being, the front runner for such a prestigious award. How's that made you feel? And since then until this period, what has been your drive?
I think that it's important to mention that when you have an enabling environment to work and to innovate, it goes a very long way. So since the beginning of the administration of Governor Sanwo-Olu, he has made it very clear that health insurance is really important to him, and he has given us in the agency wings to fly. There's nothing that you ask for really that the governor is not willing to support you to achieve. So when you have that sort of environment in terms of political will and an enabling environment, then certainly you'll be able to, move the universal health coverage agenda. You'll be able to move it forward. So yes, we are very proud of our governor. We are very happy, and we are happy that we are making him happy as well. We know that yes, we've done a lot, but there is still so much to do. So we don't let the flowers or accolades get to our head, because so yes, you've done quite a bit, right? But there's still so much more yet to be done, and we are focused. One of our mantras in the agency is that you have to innovate or you die, because the truth of the matter is that in Nigeria, social health insurance is new. So all the agencies across Nigeria are pioneering this initiative. There is no template or blueprint that you're looking at.
Yes, that's true.
You are the blueprint, you are the template, and you have to keep looking at how you can improve on what you're doing in real time. So relying on data, relying on technology, and things like that, and benchmarking yourself across the shores will help you to know that you are. Last one, you still have quite a way to go. That is how we motivate ourselves to just keep, improving on what we are doing. Of course, with the support of Mr. Governor, as I mentioned. Thank you.
Fantastic. One would expect that, because it is the state, you probably might not necessarily have any issues with fundraising or funds wise as far as to continue to finance this particular program. But have there in any way been issues related to that?
So one of the things that the law was very clear on is that there will be a fund. It's called the Lagos State Health Fund. It is ring fenced, and that money that fund takes in all monies to do with health insurance. So whether you're paying your premiums, if somebody wants to donate something, if some monies come from federal government like the Basic Healthcare Provision Fund, etc., monies are kept specifically to be able to implement health insurance in Lagos State, and it's not used for anything else, right? So that is it's called a risk pool that we're building, and because that money is not diverted to doing anything else, we have not, I would say, have had any challenges with regards to funding. There is funds that come to us with regards to overhead to support the agency from the state government, and that has been something that we have been able to access. So really and truly, I would say that the agency has been blessed with the visionary leader that we have in terms of Mr. Governor, and that the state has kept to its word in terms of ensuring that this program not only starts, but it is sustained.
Once again, this is about the moment where we begin to draw the curtains on this conversation this morning. But before we do so, Dr. Manuel, I just want to know any concluding thoughts you might just want to admonish the listener on this morning as far as, the Lira Eco is, all about.
Well, I would like to just say to our people that Lira Eco is real. You hear things like, oh, it's a government program, it's a scam, and so on and so forth. They say that the taste of the pudding is in the eating. And that's why one of the reasons why we deliberately bring out these testimonials from real living people that have benefited from the scheme. You need to come on board. It is a dream come true for Lagos residents because it is heavily subsidized by the government. For the benefit package that we are offering, the scope of services, the amount that you're being asked for is a pittance, really and truly, for what you are going to get provided. So come on board. Take responsibility for your family's health and yours, and ensure that you are able to assure your family quality of life and a very healthy living so that everybody can do what they need to do and you can aspire to the greatest for yourself and your children. It's really important. That's why we champion family plan, because if you cover just yourself and you leave your wife and children out in the cold, eventually you're going to have to go and join them in the rain if you have not brought them undercover. So please, Lagos residents, let us get on board this Ilera Eco. It is here to stay. It is for our own benefits, and it can only do us good. We do not want to, have to wield a big stick to get people on board, because this thing is for your benefit, really and truly. So we are here to ensure that you know what health insurance is, you know how it can benefit you, you know how you can come on board, and everybody's happy. And Lagos is Ilera Eco. We have Ilera in Eco.
Absolutely. And there you have it, legacy. You know what they say as well. For those who fail to plan, you're planning to fail. Put into consideration the laws of the 5 Ps. Proper preparation prevents poor performance. It's important that you plan for your future. And that is why we have this here now for you. Once again, for those who perhaps might have missed out on how to be a beneficiary to this, if you might please just reiterate so they can take that in one more time.
Okay, so you can self-register on our website, which is www.lashma.com. You can send us an email on iliraeco@lashma.com. You can reach us on our social media handles, which is on Facebook, Twitter, Thread, TikTok, LinkedIn, and even YouTube at Lagos State Health Scheme or LAG Health Scheme. You can also call the call center, which is 24 hours. We have a sales hotline, which is 0700 Ilera Eco. That is 0700 453 72356. We also have toll-free lines 0800 Ilera Eco and 0800 Ask Lashma. There are WhatsApp numbers you can get us on 070 453 58275 as well as 070 461 651. There is a chatbot that you can chat with our client services also on the website. You can walk into our offices in Ikeja, Badagry, Ikorodu, Lagos, Ekpe. This information is also on our website, and we have subdivisional offices, as I said. Thank you.
Dr. Emmanuella Zamba, it's been an utmost delight and pleasure having you grace our studios with your presence and insight as far as this is concerned. And of course, I'm sure to the listener, you've learned one or two as far as this is concerned. So from me to you, once again, you've been locked onto Nigeria's phone health radio station, Wash 94.9 FM. It's 11:45 here. Coming up by 12 will be the News Global with Sarah. And of course, launching into the lunchtime mix. And of course, more exciting programming just for your perusal. Keep it here on Nigeria's phone health radio.
Wash 94.9 FM.